Health Nuts, episode 42.
You're listening to Health Nuts with Dr. Chris Carr. Making lifestyle changes is hard for many people, and not knowing what to do or how to do it makes the task all the more daunting. Here at Health Nuts, we focus on helping you live a fuller life by discussing everyday health issues and exploring breakthrough solutions on how to overcome them. And now, here's your host, Dr. Chris Carr.
Welcome back to another episode of Health Nuts. I'm your host, Dr. Chris Carr, and today I have an awesome guest for you, someone I've been following for a while, coming all the way from Houston, Texas, and that is one Dr. Tabor Smith. He comes with an education background from an undergrad in Eastern New Mexico, as well as a doctor of chiropractic degree from Parker University in Texas. He has 11 years under his belt in the profession. He runs 2 highly successful chiropractic clinics, is a author of a book, which we'll give you a link to get yourself into, as well as a program with Spinal Hygiene. And that's what today's topic is all about, is just like there's dental hygiene, there's spinal hygiene as well. Tabor is the master at this, and he's going to give you his experience on how to make sure your spine is healthy for the years and years to come. Dr. Tabor, thank you so much for coming on and sharing your message with the audience.
Absolutely, man. You nailed that. And I appreciate it. Thanks for giving me the opportunity to share.
And talking to you pre-interview, what I want to get into just right away is your story. So that's somewhat of a formal intro of you. Obviously, the schooling comes into play because we got to make sure that the audience knows that you're a black belt, if you will, and you got a lot of experience under your belt. Outside of the business world, tell us a little bit more personally about you.
Sure, absolutely. So growing up, my family was very sports oriented. My dad was a high school basketball coach, and my dream basically was to play high school basketball varsity team for my dad. And every summer, all year long, I mean, we just practiced and played, and tried to work our best at sports. And anybody who's been in that situation knows that there's a lot of bangs, there's a lot of falls, there's a lot of they say that it's not a contact sport, basketball, but really it is. All the kids falling, getting pushed down, and all those stresses, those physical traumas just kept continuing to add up inside my body. And I got to be a junior in high school. I had tried out for the varsity basketball team. I had just made the team. I was ecstatic that I was going to get to play that year. And right about that time, I started having back pain. And I had this lower back pain that was just intense, man. And my dad gave me over-the-counter pain medications like any other parent would do, or most parents would do. And, it took the edge off a little bit, but nothing helped it. In fact, it kept getting worse. And so my parents took me to the medical doctor, and they gave me muscle relaxers, pain pills, anti-inflammatories. And I was trying to take those. I was trying to play. And I got so bad, when I would move in certain positions, it would send shocking pains down my legs, and I couldn't play. I had to sit the bench. I sat that whole season on the bench watching my friends play basketball. And I'll never forget, one night I woke up just in spasms all over my body, screaming pain. My parents were scared. They didn't know what to do. They took me to the emergency room. We did x-rays, CT scans. I don't know what all imaging they did really, but I know we left with a referral to a neurosurgeon. And I just thought life was over. I was like, I'm never going to get to play. I'm never going to get to do the things I want to do. And it was about that time when our family member, was an aunt and uncle of mine, had been going to a chiropractor in our town, and they had had really good results. And so they told my parents, just take Tabor to our chiropractor and let him check him, right? And of course, my dad was the whole, we've already been to some really good medical doctors. They didn't tell us to go to the chiropractor. They told us to go to the neurosurgeon, all this stuff. And my aunt and uncle were persistent, thank God. And they said, okay, we'll try it out. And I'll never forget, I went, they did a full exam. They did their own x-rays on me. The x-rays they did were different because I was standing, I was weight bearing, they would take them in certain positions. And they brought us back in for what they called the report of findings. And they showed me this area in the lower portion of my back, in my lumbar spine. And it had shifted so far forward, it caused a stress fracture. And I know now it's called a spondylitic spondylolisthesis, right? The stress fracture had healed, but at some point, all those repetitive stresses had built up to a massive amount of stress in my lower back and actually caused a stress fracture. And he said it was putting pressure on the nerves that were sending shocks down my legs whenever I moved. And it made sense, man. I saw it right in front of me. And he said, it's not going to go away instantly, but I know we can build this, strengthen your lower back. We can improve the alignment, take pressure off the nerves. Your body can heal. And I just remember walking out with hope and that something could actually be done. And it was an epiphany right then, because I realized I'd been taking those pills, but they weren't doing anything to fix the problem that was right there on my x-ray. And this guy was going to actually attempt to fix that problem. And so I went to his office every other day before school to get my adjustment. And I never missed a visit. And he was right. It didn't go away instantly overnight. But within about 3 months, I was a normal teenager again. I could function, I could move, I could play sports. I practiced my butt off all summer long to try to make that varsity team again my senior year, which I made it. I did more than just make the team. I was the leading scorer my senior year for varsity basketball team, and I got to play 2 years of college basketball at Eastern New Mexico University, which I never would have got to do any of that if it wasn't for chiropractic. So of course I said, who in their right mind would not want to be a chiropractor? And I went to chiropractic school.
So you had, and height-wise, if I recall, you're like 6'6", 6'7", aren't you?
Not that tall, but I'm about 6'4". So
you're 6'4".
Yeah, 6'3", 6'4". I on the sheets, and we always try to stretch ourselves. So I was hitting about 6'4". They might have put me down at 6'5" every once in a while, but I'm really not that tall.
So it's amazing, because I've been doing this for past year and a half, 2 years now, and it never fails the moments of decision that came across your way. Imagine if you would have made a left instead of a right. And what that would have turned into, and who knows what would have happened from that surgery. It could have been a massive success, and you still could have been good, or it could have just been a complete nightmare for you. So it's amazing your body was able to heal itself. And talking about innate intelligence, which we did pre-interview, I would love for you to share. So to the audience, innate intelligence is something that we all have instilled within us. If all of you were to take a small knife out right now and cut your arm, your body would send a message saying that you need to stop that from bleeding. What that is, that's your brain telling your body that there's something going on, and you're not doing it consciously. It's your body taking over that, and that's what we would call innate intelligence. Tabor has an amazing story about his young son. If you wouldn't mind just sharing that story with the audience.
Yeah, absolutely. So I went to chiropractic school, and I learned exactly what you just said, that this nervous system is the master system of the body. It controls every function of the body, including healing. And I realized that's what happened inside my body, was that the chiropractor removed the pressure from my nerves, which is the master system of the body. And then my body was able to do what it was designed to do in the first place, which was heal. And so through chiropractic school, I got that education, I got that background, I realized it. And I realized this is one system in my body that I want to take care of for a lifetime, that I want to make sure I never go back to that pain. But even bigger than that, I want to make sure that my body's functioning at maximum, so I can just have the best and the maximized potential that's in there. And so my philosophy had been growing over those years, but something happened to us about 4 years ago, last month, and it was life changing. And so we had found out we were pregnant, and we had twins. And so the twins were born June 2nd, 4 years ago. And one of the twins, well, unbeknownst to us at the time, had heart defects. He was born in at a midwife, at a birth center, right? So they checked everything. His body was functioning just as well as his brother's. But he actually had a condition called transposition of the great vessels. It's where the two large arteries out of the top of the heart are backwards. They're switched. But his body his intelligence had created this, what we call defect, but it had created it in such a manner that it was supplying blood to every area of the body, so much so that he was the exact color as his brother. He had the same energy as his brother. You literally from the outside could not tell. And so we went on without even having him checked anywhere else. Everything was fine. 6 months into it, though, he's not moving as much as his brother. He's not as active. He starts to develop some purple nail beds, and I was listening to their hearts, and I heard a murmur, and so we took them to a cardiologist, and the cardiologist said, murmurs are normal, right? People have them. Some people it's something, some people it's nothing. So he said the next step is to get an echo. So we take him to an outpatient hospital to get an echo, and while they're looking at this heart, that there was actually a technician who was doing the echo. She's just learning, and she's like, I have no idea what I'm looking at here. I have to go get the head guy. And so he comes in and he goes, we've got to get you over to Children's immediately. And so we went there. I literally walked with him in my arms into the hospital, but walked right up to NICU and placed him in the bed. So he's perfectly fine, right? He's not going out, going crazy or anything. But they discovered that he had these heart defects. And here, let me explain to the audience right here what these defects were and why this is so amazing and how it affected my philosophy. So, transposition of the great vessels. If a baby would have been born with just transposition of the great vessels, they don't live past birth. As soon as the umbilical cord is cut, if something is not done immediately, they don't make it, right? So Jaden had that transposition of the great vessels, but he also had a second heart defect, which was called a ventricular septal defect. It's basically a hole in the middle of the heart, and it allowed oxygenated blood from the left side to get through that hole to his right side. So it was able to take oxygen to the rest of his body, which in itself is a miracle. And if he only had those two defects, then he would have survived. He did, and he survived even longer. And to me, that would have been a miracle. I'd have been like, wow, there's an amazing intelligence inside of his body that did that. But then I did even more research on the development of the heart and cardiovascular system, and I noticed that if he would have only had those two defects, the transposition of the great vessels, the hole in the heart, the ventricular septal defect, then the right side of his heart is a lot larger than the left side. So it would have had so much pressure on his lungs that he would have developed fluid in the lungs and he would have drowned if something wasn't done again very quickly. So this intelligence inside Jaden's body, which is there for adaptation and survival and all these things, it caused a third defect called pulmonary stenosis. So it's a tightening of the artery that goes to the lungs. It protected the lungs and it pushed more oxygenated blood across that hole in the center of the heart and got oxygen to all of his body. So I apologize for getting technical in that story, but I realized you and I and the medical system, we call these things defects, quote unquote defects. We think they're not supposed to be there. But what I realized was that was part of my son's amazing intelligence, actually, inside of his body, that something went wrong during development, whether it was genetic, whether it was a toxin that was introduced, whether it was a subluxation, which is a misalignment of the spine. And my wife had an 18-degree curvature in her lower portion of her spine, which we've been able to get down to 9 degrees through corrective care, chiropractic. So it's improving, but it's not perfect, right? So there may have been pressure on the nerves that were developing this fetus inside my wife's body. So there's a lot of different things that can cause an interference. But the intelligence of the body does whatever it can to survive, and that's what Jaden's body did. It's the only reason he's here today is he has an amazing innate intelligence, just as we all do, inside of his body. And I always tell people that I thank God for the surgeons that they did open heart surgery and they did corrective care on his heart, just like we do corrective care on the spine, so we don't do surgeries, right? And they fixed that. They fixed his plumbing, right? But I realized when they put his sternum back together and they wired that and they put the last stitch inside of his skin, then the surgeon can't do any more after that. Then it's up to Jaden's amazing intelligence again to mend that bone back together and to mend that skin. And that right now he's 4, he's healthy, he's doing awesome because we've made sure that his spine and nervous system are functioning at max. There's no more interference, that amazing intelligence inside of his body is doing what it's designed to do. He's running around with the scar on his chest as a reminder, but to me, that's a reminder that there's an amazing ability that can heal, and his body's a great example of that.
It's such a powerful story on multiple levels. I got goosebumps just from you saying it and it being a father, and just imagining just the emotional stress to go through. But to be smart enough to understand that there's limitations to matter. And at that point, you could have adjusted Jaden every day for the rest of his life, and it wasn't going to fix it. So those limitations to matter were at that time. Right. And something else needed to take place. Unfortunately, in the system that we have, those limitations that matter aren't always to the extreme cases that you have, and the Western medicine takes over much sooner than it really needs to. Right. And at that time, go ahead.
I was just going to say, here's how I kind of look at that is we were created with an innate intelligence, which we can prove that. I mean, I'm not beating my heart right now. You know what I mean? I'm not digesting my food right now consciously. That's my innate intelligence doing all that. And we were also born with an educated intelligence. And that's why we went to chiropractic school. We learned all about the spine. We learned about that nervous system. And we've got to understand both of those, that innate intelligence and that educated intelligence. And sometimes we just get in this one side. We're so educated, we think we know everything. And we say, forget the rest of that. Forget innate intelligence, that there's actually something inside my body that works. You know what I mean? Let's go over here to an educated, and let's put this chemical in there, and let's put this chemical in there, and we try to manipulate it instead of really trusting in it. But I understand then sometimes we have to say, like you said, there's a limitation to matter. There's a time we need to step in. If I'm stuck on a glacier, freezing, right, my body will do something very intelligent. It will actually pull my blood to my core, so much so that my fingers will fall off from frostbite, but it will help me survive longer. But if I don't get off that glacier, it will only adapt to a certain point. And so I need to have educated intelligence. That's that helicopter that comes in and gets me off of that glacier. Now I go back to understanding and trusting in that innate intelligence to make me healthier.
Yeah, I love it. And it's why I love having principled chiropractors on this show, because it's, we're cut from the same cloth.
Right.
Your body's doing exactly the right thing at exactly the right time.
That's right.
And I loved it. The nuts and bolts to this podcast is on spinal hygiene.
Sure.
To the audience who does not know, like, what the heck is spinal hygiene? I just know I have a dental hygienist, but what the heck is spinal hygiene?
Yeah. So great question. And so as I grew up and realized that my spine was in such bad shape, I was also going to the dentist. And my family, we went to the dentist very regularly. And so I had braces and they took care of my teeth. And every time I went into the dentist would say, are you brushing? Are you flossing? Are you taking care of your teeth? And if I wasn't, he was kind of just woodshed me a little bit, right? He'd be like, you need to get back on that. And I realized when I got done with the chiropractor that my spine was corrected. I never wanted to be back there in that predicament again. And I was like, nobody ever taught me how to take care of my spine, right? No wonder it was in terrible shape. Imagine if I had never brushed or flossed my teeth, and then all of a sudden I'm 16 years old wondering why my teeth are falling out and I've got all these cavities. And so when that chiropractor corrected my spine, so much so it made me go to chiropractic school. I vowed that I was just going to figure out what a healthy spine is and how to keep it that way. So I never had to be in that predicament again. It was horrible. And I realized that there are 3 areas of health to the spine. Now, of course, there may be more, but to simplify it, we always say that the spine should be in a certain alignment, right? It should be in a good alignment. It should move through a full range of motion, and the muscles around it should be strong and balanced. And those are the 3 areas of spinal hygiene. Now, a chiropractor, so a vertebral subluxation, you might hear us talking about subluxations. That's what a chiropractor corrects, just like a dentist corrects cavities, right? But a subluxation is where one of those or more of those 3 areas, alignment, range of motion, imbalance in the musculature, sometimes a bunch of those together will cause interference or pressure on the nerves. So I go to the chiropractor, I get checked for subluxation, they correct it, but then I'm back home doing my spinal hygiene exercises on a daily basis to try to keep that health as long as possible. And just like you brush your teeth, there's no guarantee you're never going to get a cavity. So that's why we have a dentist on our health team. And just like you do your spinal hygiene exercises every day, there's no guarantee you won't have a subluxations. That's why we keep a chiropractor on our health team. And we do regular family checkups. So we have big entire families that come in anywhere from weekly to bi-weekly or even monthly to get their spine and nervous systems checked. And then when we find areas that need to be adjusted, we adjust them and we send them home again, asking them, have you been doing your spinal hygiene exercises? Are you taking care of your spine from home? Because it's that important. In fact, it's more important, in my opinion, than taking care of your teeth. It controls the function of everything. So if you don't take care of it, yes, you're going to be in severe pain someday, but also even worse than that, your body's not going to be functioning like it was designed to function. It's not going to be functioning at top notch. So
if you have, in layman's terms, so if you have a pulse currently, you need to be doing spinal hygiene.
Yeah, if you have a what?
A pulse.
Oh, absolutely. If you have a pulse currently, yes, exactly. I agree. And so what we did was we built a system for our patients to help them keep those 3 areas, spinal alignment, spinal range of motion, spinal strength. And we give them, if you go to a dentist, you get this package, right? Every time you go in, you leave with every time it's like toothbrush, floss. There's even new cool stuff in there now that I never saw when I was a kid, right? But they give you all this big old packet to take care. Why would a dentist do that? They don't make their money on me brushing my teeth. In fact, they probably make more money if I don't brush my teeth, right? Because I'd have to keep going back to them. But no, actually, the real reason is they become my expert in dental health, and I rely on them to help me to build great dental health. And that's what we want to be for our patients in our chiropractic office, is that expert that helps you to have great spinal health for a lifetime. And so we give them a pack, and it has several different things. If we're looking at the spinal alignment, if for those maybe the people who don't fully understand chiropractic out there, the spine should be in a certain alignment. If you're standing, looking straight ahead, in what we call good posture, the spine should be straight, or at least relatively straight from front to back. So if we see tilt shifts, translations, or curvatures in that view, we want to correct those, right? The spine from the side, if you're in a good posture, again, the spine from the side should not be straight. It should have natural curves. And so what we use is a spinal molding roll. And for these spinal molding rolls, we give to our patients, they place one underneath the curve of their neck at night, one underneath the curve of their back, and they lay, and just like the term says, they mold their spine for about 20 minutes a night. They mold those curves back in. So that's a very common alignment issue in today's day and age, especially because technology, computer screens, all these crazy things, we're sitting for long periods of time. And so that helps them in that one area of spinal health. It helps them maintain those curves or maintain that alignment between their chiropractic adjustments.
Yeah, I think you hit the nail on the head with the environment that we have. At a young high school student last week, and his mom's like, he's on the iPad all the time.
Mm-hmm.
And looking down, the studying, the iPad neck, the texting, the force of gravity, all of it. We're bent over adjusting tables all day. It is so common to have that translation. But if you wouldn't mind sharing with the audience what the nervous system happens, what can happen whenever that neck is so far off? Is it just neck pain, or what else can happen?
So watch this. So spinal hygiene, if you had to say what's spinal hygiene for, I would not say just to keep you out of pain. I would say the spinal hygiene is for the prevention of spinal degeneration, because we are seeing more and more degenerative disc disease. So I'm going to use several different terms, but they all mean the same thing. Spinal degeneration, degenerative disc disease, osteoarthritis of the spine, all those things are basically referring to a breakdown or a decay of the spine. And we're seeing more of it in this day and age than we ever have in the history of the human race. In fact, the statistics are crazy. This actually comes from I think it was the Chicago Institute for Neurology or something like that. I can actually get you the links if you need the references. But they show that 96% of 80-year-olds in today's day and age have degenerative disc disease. 85% of 50-year-olds have degenerative disc disease in our day and age. And we used to think that degenerative disc disease only came with age. We used to think it was kind of a normal process for aging. But now there's studies that show that almost 40%, I think it was actually technically 37% in the study, of 20-year-olds have degenerative disc disease at the age of 20. That's not old, right? And then there was a recent study that came out of Scotland, a group of Scottish researchers. They took over 1,000 10-year-olds, and they were all asymptomatic, so they didn't have any pain at all, but they put them through an MRI so they could look at their spine, and they showed that 9% of 10-year-olds have the beginning stages of degenerative disc disease already, and they attributed that to sedentary lifestyle, because we're not moving as much as we are. Kids aren't getting recess as much as they used to. We're sitting in classrooms for longer periods of time. They attributed it to computer screens, cell phones, where it's putting us in that poor posture. It's putting so much stress on our spine that we're breaking down and decaying our spine and nervous system at earlier and earlier ages. And we call it the silent epidemic, because just like those 10-year-olds, all of them were asymptomatic. That means they didn't have any pain. We call it the silent epidemic because you don't know you have it until it's too late. And you get this flare-up of pain. You go to the doctor, they take an x-ray, they say, oh yeah, you have degenerative disc disease. That didn't happen yesterday, right? That had been happening for all those years, but then all of a sudden you have it. And I think that's why the medical systems has no motivation to actually implement anything to prevent spinal degeneration, because really, imagine if you owned a business where everybody was just a customer, and they didn't know, they had no prevention, they had no like alarm or something telling them that they're about to be in this situation. Then all of a sudden they're a customer, and they're becoming customers at younger and younger ages, where they're having to take the drugs, and then they're getting the $2,000-$3,000 shots, which is the cortisone in their spine, and then they're having back surgeries, which $100,000 back surgeries at earlier and earlier ages. They used to not be able to do a $100,000 back surgery until you were 50. Now they're getting to do it when you're 20, and then redo it when they're 30, and then redo it again when they're 40. So
it's so many good points there with the age that it's starting. It's happening much younger. A lot of times folks, they don't know any better, so they just, they go through these 2 or 3 flare-ups a year. They take their 7 to 10 day prednisone, and they get on with their life, because a lot of times the prednisone works short-term, gets rid of the inflammation, and then every year it happens, like, oh, it's just my back going out, I'll be bad for a couple of days. What's really happening in those, that's degenerating, it's worsening over time.
Yeah.
It's not just back pain, it's what we try to run home, is that those nerves in your back, they're not just going to your back. You're talking about your gastrointestinal system, your prostate, your bladder. You have all these other systems that are being affected. That's why I love your protocol with the spinal hygiene, especially. Right. And I love how you call it the spinal hygiene movement too.
Yeah, absolutely. Because I think that eventually, whether it's us as chiropractors or physical therapists or medical doctors, at some point we're going to degenerate at such a young age that people are going to say, we've got to start doing something. In fact, this happened already in the early 1900s when it comes to the teeth, because in the early 1900s there was a lot of industrialization. Processed foods were starting to get into our diet. Processed sugars became a very big staple of our diet, and teeth began to decay at younger and younger ages. In fact, you can look it up. If you were a dentist in the early 1900s, all you did was pull teeth all day. Like, you made good money, but you literally just pulled teeth all day because it was so busy. And so what they did was, Dr. Alfred Phones, he's actually the father of dental hygiene. He said, we have to start teaching people to take care of their spine at home. And dentists weren't very accepting of this at first. I'm very surprised. A lot more people are accepting of spinal hygiene than they were back then of dental hygiene. A lot of dentists said that they didn't believe people would actually spend the time and the money to actually brush their teeth and take care of their teeth. Other dentists actually said, and I've seen books where this is documented, they said, why would you teach them to take care of your teeth? We're making good money here. You're going to ruin our profession if you're teaching them to take care of their teeth. And but really what it did the opposite of that. It created this awareness that wasn't there before, that, oh, I need to do something to take care of my teeth. And what that did was that created and turned dentistry into the second largest healthcare profession in the world, the number one largest preventative healthcare profession in the world, all because of that grassroots movement to share dental hygiene. And that's why I'm so adamant about chiropractors implementing this into their office. I really think we can grow chiropractic, we can reach more people, but we have to first create that awareness that, oh, I actually have to take care of my spine or it degenerates. And once that awareness is there, then people will begin to say, well, I would love to have a chiropractor on my health team to help me take care of that spine,
Yeah, the home rehab kits is something we've had in the office for
awesome.
7 or 8 years, and it's just, I cannot agree with you more. I'm completely philosophically on the same page on how important it is to take care of the spine.
Awesome.
Before I let you go, I want to throw just a couple questions at you because I want to get your expertise on this. The patient that comes your way said, Dr. Tabor, I'm just not getting any better. I've been sick. I'm not feeling well. Life it's just not going my way. I'm on a ton of medications, and I'm not really buying that you can help me out. Somebody who feels defeated. What do you tell that patient when they walk in your door?
So that's a great question, and that's a hard question, because I always try to field and feel that person that's right in front of me, and everybody's a little bit different, right? So I've got to first completely listen to their entire story and understand them. Secondly, try to get myself into their shoes so that I can feel that. And then thirdly, try to encourage them to understand that, like we've been talking about, that there's an amazing healing ability inside of their body. And it's still there. And I can guarantee it's still there, because I could cut their finger, like you said, it will heal. I could cut my desk right now, this desk that I'm sitting at, it will never heal. It will never change, right? That will be there forever. So in my philosophy, I try to tell people that I don't really believe it's about putting all this other stuff inside of their body to try to get it to work right. I think that so many times it's about trying to find the interference that's keeping it from working right, that's keeping it from doing what God designed it to do. And then once we find those interferences, if we can just remove them, now their body can start to heal. And so right now there's some interferences in that young lady's life that are keeping that amazing intelligence from doing what it's designed to do. Let's start looking deeper in our exam process, and as you're experiencing our office, let's start looking for those interferences. And it might be coming straight from the spine. That's why we're going to do specific, accurate x-rays, because if we see interferences in that nervous system, we need to remove those immediately. There might be interferences in your life, like there's toxins that are coming in. We might be smoking. We might be around smokers. We might be having, poor diet or not getting enough movement or exercise. So some of those interferences, maybe we can begin to help that lady out. I think we're calling her a lady. So that young lady out with her health there, and just removing those interferences automatically starts to build that up. Yes, there's some things you might need to put in the body, whether there's deficient in some supplements or things that God needs you to have, to be healthy. But most of the time I found it's about removing interferences, not about adding a bunch of other stuff.
And if you're able to go back, I always like to call this back to the future question. If you're able to go back, 20 years, 15 years back to your younger self, what's maybe something you would tell yourself back in the day to get you through where you're at now? Hey.
I would tell myself to relax a little more in the moment and realize that, this might sound cliche, but that everything happens for a reason, or at least good things come from the bad things that happen. And so if I looked back, when I was going through this horrible time in my health, when I was a teenager and I had horrible back pain, I was thinking life's over, it's miserable. It's going to be terrible. I can't do anything I want to do. But I wouldn't realize that now that's one of the biggest life-changing events of my life. I would never go back and actually change that, because I wouldn't be a chiropractor today if that hadn't have happened. With my son, obviously, him having a heart defect when he was born is not something that you would want, but I realized it absolutely changed my philosophy, and he's an amazing human being. And so that story for him is going to be something that makes him stronger, that he's going to be able to share. So I guess I would just tell my younger self to look for the good in everything that happens, and realize that that it's going to build you and it's going to create you as you grow.
I love that share, and it hits home on a number of different levels to me. So I appreciate you sharing that.
Yeah.
The last thing I want you to share with the audience. One is the book that you have. How do they go about getting it?
Great. So the book is called At Home Spinal Care, and you can go to homespinalcare.com, and you can actually get it free. All you have to do is pay for shipping. Great.
And those folks are looking to find you. How do they do it?
Well, my personal email, you can always email me at drtabor@live.com, but we do have Facebook pages, Spinal Hygiene Doctor. You just search Facebook for Spinal Hygiene Doctor, like our page, follow us that way. But I'm always available if someone needs some help or has some questions.
All the links that he has shared, I'll put them in our show notes as well, so you can click right on them, and you can follow him as well. He has a lot of good content online. And I do have a following of other docs as well. If you wouldn't mind just sharing your spinal hygiene movement and the
Sure.
Yeah.
Awesome. Let me share two websites. There's the first one is where docs and even the public can go to buy spinal hygiene products. Doctors can actually go to the wholesale portion of the website and buy it in a larger bulk and get discounts. But it's spinalhygieneproducts.com. So that's plural, spinalhygieneproducts.com. Then the other website I would give doctors is spinalhygiene.co. And that actually gives them a lot of the information that I use in my practice for free. They can get the flyers and the PDF downloads and all of those things just by going to spinalhygiene.co.
Okay. You're a man on a mission. That's one of the reasons why I wanted to have you on. I do appreciate it coming on, sharing your message, especially about your son. And I just appreciate everything you did today. And thanks for coming on.
Thank you, brother. It's been an honor.
Great. To the audience, hope you're enjoying this content. It's for doctors like Tabor that come on, share their message, and make this show possible. So I hope you enjoyed this content. I look forward to having you and talking to you next week. Have an awesome and blessed 4th, and talk to you then. Bye now.
So, you've heard from the experts yourself this episode and have gotten some golden nuggets on health. There is so much more to come and so much more to learn. Head on over to pghcw.com. Again, that's pghcw.com, and sign up for our newsletter where you'll receive free info on how to get and stay healthy. Thanks for listening, and we'll see you next time on Health Nuts with Dr. Chris Carr. Be sure to subscribe to the podcast and please leave a review.